So in this session, we would be discussing about emergency contraception. So emergency contraception we provide for a couple after unprotected sexual intercourse. This should not be the standalone contraception. If at all they had some episode of unprotected sexual intercourse, this method can be given. And yes, let's see which are the drugs that we gave, how long after sexual intercourse these medicines can be given. Let's go into these key features. Among this topic of contraception, emergency contraception is an extremely important topic. Often questions come from this. Yes, a very important topic as such. So emergency contraception is also known as interception. The main mechanism by which these drugs are going to act is mostly they act by delaying ovulation. Some of them even act by inhibiting the implantation. But after implantation, these drugs are not effective as such. Among the various drugs, these are the methods that are available. So often they ask an all except question. So let's go through this list of the emergency contraceptive. You have copper T. Copper T is basically copper containing intrauterine device. Copper containing intrauterine device. So which category is your copper T, or which generation is copper containing intrauterine? They are second generation devices. If they give you third generation, or they have given you something like Mirena, which is a third generation Levonorgestrel containing intrauterine device, please note we don't use that. What we use is copper containing intrauterine device. Next you have Levonorgestrel containing tablets, which commonly comes under the term I-pill. You might have often heard this common brand name, that is I-pill. So levonorgestrel is basically a progesterone. This levonorgestrel is the most commonly used method among all these contraceptions. How to give it, when to give it, all this information we will see soon. Next you have Ulipristal, also known as Ulipristal acetate. Ulipristal acetate is an SPRM, selective progesterone receptor modulator. Ulipristal is a selective progesterone receptor modulator, that is SPRM. Next we have Mifepristone. Mifepristone is an anti-progestin. Anti-progestin, this is an off-label drug as such. This is not commonly used, this is not approved to be used for this purpose in India, but yes, there is some role even for this anti-progestin, that is Mifepristone. Next, even we can use OC pills, the same oral contraceptive pills can be given in a regimen known as USP regimen to induce, again, to prevent this pregnancy after unprotected sexual intercourse. Finally, we have Sencromen. Sencromen is basically ormeloxifene. Contains ormeloxifene. Even this drug can be used as an emergency contraception. Let's go into this. Among these, the most important ones are the initial three: copper T, LNG and Ulipristal acetate. These are the ones that are approved. These are the ones that are commonly used as well. Among the methods, levonorgestrel or I-pill is the most commonly used method for emergency contraception. This is the most commonly used method. What is the dosage? Levonorgestrel or I-pill is usually given as single tablet or single dose 1.5 milligram within 72 hours of unprotected sexual intercourse. So the dosage is 1.5 milligram single dose within 72 hours of unprotected sexual intercourse. So please note these key points: 1.5 single dose within 72 hours. Apart from this, we can even give this in a divided dosage. That is, we just divide it into two and we give them 12 hours apart. That is 0.75 milligram. 12 hour apart can also be given within 72 hours. So either 1.5 milligram, this is the most commonly used regimen. Apart from this, you can just split it and give it. That is 0.75 milligram is given 12 hours apart. 2 doses 12 hours apart. Yes, so the most commonly used, the best also you can say within 72 hours is levonorgestrel. Again, the main problem with this drug is that they don't act after the date of ovulation. Ideally, all these tablets which you are giving, like your I pill, levonorgestrel, even ulipristal acetate, both these have to be given before the date or at least on the date of ovulation. Ideal is before, even on the date of ovulation. Post ovulation, they do not act. Why? The main mechanism by which these drugs act is by delaying ovulation. They act by delaying ovulation rather than repeating that. They act by delaying the ovulation. So, your copper containing intrauterine device, they can be given ideally within 5 days of unprotected sexual intercourse, and maximum it can be given till 7 days after sexual intercourse. So copper containing intrauterine device can be used ideally within 5 days of unprotected sexual intercourse, but it can be used maximum till 7 days. Maximum till 7 days. This acts by inhibiting the fertilization and implantation, and copper T is that drug that will actually help you even beyond the date of ovulation as well. Next comes ulipristal acetate. Ulipristal acetate is given as 30 milligram tablet, single dose. 30 milligram single dose within 5 days. What is meant by 5 days? You should know in hours as well. That is 120 hours of unprotected sexual intercourse. We can give ulipristal acetate 30 milligram single dose within 120 hours of sexual intercourse. Even these drugs act by delaying ovulation or even inhibiting ovulation. These three measures you have to know. Let's just compare these measures as per the mechanism as well. Both your levonorgestrel and ulipristal. Levonorgestrel is a progesterone containing tablet. Ulipristal is a selective progesterone receptor modulator. Both of them, they are given as single dose. LNG act within 72 hours. Ulipristal is 120 hours. Both of them act by delaying ovulation, and even some effect is there in inhibiting ovulation. But if you have to choose one answer, the mechanism is basically by delaying ovulation rather than inhibiting ovulation. If delaying option is not there and you only have this option of inhibiting ovulation, you are going to choose that. Inhibiting ovulation. Whereas your copper T or copper containing intrauterine device, who are basically the second generation device, yes, second generation IUDs, their action in this prevention of unprotected pregnancy, repeating that, their action in prevention of this pregnancy after unprotected sexual intercourse, they will inhibit fertilization and even they can inhibit implantation. Fertilization and even implantation. Fertilization and implantation. Both these drugs, we told the cutoff 72 and 120. This copper containing intrauterine device, 120 is ideal, but it can be used maximum till 7 days. This is the only contraception which has so much time period. It is going to act even after sexual intercourse. That is your copper containing intrauterine device, maximum till 7 days after unprotected sexual intercourse. The other three medications, you have to know that they can be used, but they are not very commonly used. You have Sencromen. Sencromen is given as 2 tablets, 12 hours apart. 12 hours apart within 72 hours of unprotected sexual intercourse. 2 tablets means usually 1 tablet is 30 into 2, 60 milligram. OC pills we give in this regimen as mentioned USP regimen. USP regimen, the basic principle is that you have to give 100 microgram of ethinyl estradiol. So as you know, OC pills have estrogen and progesterone. We nearly give 100 microgram of estrogen. We give 2 doses 12 hours apart. So if you're taking your low dose OC pills, how much estrogen is there in that? It is 20 to 30 microgram. That is why we give 4 to 5 tablets, and again after 12 hours you are going to again give 4 to 5 tablets. Not a commonly used measure. And previously we had this high dose OC pills. If at all you are using high dose OC pill, that itself contained 50 microgram. So to make it 100, you just require 2 tablets. Again after 12 hours you will again give 2 tablets. So OC pills, if you are taking low dose OC pills, if you take low dose OC pills, you will give 4 to 5 tablets, and again after 12 hours you have to again give 4 to 5 tablets, and this has to be completed within 72 hours. Within 72 hours. If you are giving high dose OC pills, same thing, the difference is here you give 2 tablets, again after 12 hours you are going to give 2 tablets. Mifepristone, an anti-progesterone which comes under the name RU486, it is off-label. The drug dose varies between 10 to 600 milligram. Again, this is off-label. We don't use mifepristone for this purpose commonly. So yes, they might give something apart outside this list and ask you an all except question as such. So like option could be levonorgestrel, progesterone, copper containing intrauterine device, OC pills, or estrogen alone. We don't use estrogen alone. We give progesterone alone, or we give a combination of estrogen and progesterone. Very often ask all except question and have a special note of the initial 3 category, which is very, very important. So these are the key information that you should know about emergency contraception.